Good afternoon. Good afternoon, and thank you for tuning in today to our regular updates. I hope you find them to be useful, and it is my goal at the end of these that you breathe a little easier, knowing that we have a fully staffed, very comprehensive, very aggressive response to the COVID crisis here in the state of Rhode Island. Two quick pieces of housekeeping. Tomorrow, this briefing will happen at 2:30 instead of at 1 o'clock. And then after tomorrow, we'll go back to 1 o'clock every day. Also, one additional programming note. Tomorrow morning at 8:30, Commerce will be hosting a special Facebook Live discussion with Mark Hayward, our Small Business Administration District Director, and they'll be answering any of your questions as it relates to the new SBA program for businesses. I will say we're in very close contact with small businesses on a daily basis. I know many of you are really struggling right now, and we're working hard every day to advance you money, help you with bridge loans, help you apply for the SBA initiative. It's also very complicated, and many of these programs are oversubscribed. So if you're a small business and feel that things are confusing or you need a hand, I would urge you to go ahead and join tomorrow morning, 8:30 a.m., the Facebook Live discussion, and it will be primarily focused on the new SBA program. Today I'm very sad to report another 3 deaths here in the state of Rhode Island as a result of coronavirus, bringing us to a total of 30 deaths in Rhode Island. We have 147 new cases, bringing us to a total of 1,229 cases. And at this point, we have 123 people in the hospital. And in a few minutes, I'll turn it over to Dr. Alexander Scott to address the details. I want to begin today with another very serious reminder that at this point in the crisis, everybody needs to be keeping a journal of their contacts. It is not enough to have a mental list. Don't tell me you're remembering it, you have a mental list. We're all very distracted, anxious, and busy. You won't remember unless you write it down. Every single day, I want you to take out a pen and paper and write down who you had contact with and where you went. Again, I really hope, since you're obeying the stay-at-home order, you're saying you were in your house and had contact with a couple family members. But if you have to go to the grocery store, if you're one of us that has to keep working, I need you to be serious about this. The discussions we're having now are moving in the direction of we're not going to allow folks to get testing unless they show up with their contact tracing notebook. I'm not announcing that today, but I want you to know that's how serious this is. This isn't an option. This isn't for some people. This is every single person in Rhode Island every day writing down on a piece of paper who you were with and where you've been. I want to get this economy open. I want to get Rhode Islanders back to work. I think about it every day, all day. There's way too much human suffering out there right now because of all the people who are out of work. So in order for that to happen, you guys, all of us, have to do our contact tracing. So I can move us to a place where everyone can get a test quickly for free if they want it, and then we can immediately put into quarantine and isolation people who are positive, and we can immediately test the folks who they had been in contact with. So please, I know times are tough right now, but cooperate with this. We can keep you safe and healthy and get everybody back to work much more quickly if we're all doing our job on contact tracing. To that point, I want to reiterate a few life-saving but simple-sounding things that I need everybody to do. Let's be honest, this is getting old right about now. We've been at it for 5 or 6 weeks, and it's really hard. Hard for all of us, hard for me every day to remember to wash our hands constantly, to not touch our faces, to use a face covering, a cloth face covering when you're out in public or at work, to wipe down surfaces every few hours in your home or at your place of work, to cough into your elbow instead of coughing into your hand or just coughing without covering your mouth. Really simple stuff, but we have to be vigilant. We have to be vigilant about it every single day, and we're going to be doing it for a while. We're going to be doing that for the next year. So just figure out ways. I'm hearing all kinds of creative things that people are doing in businesses and in families to make sure that everyone's using enough Purell and washing your hands enough, covering yourself when you cough. But please stay at it. Don't let yourselves get relaxed about it, because it's simple, but it's a new normal, and it's going to keep us all safe and healthy. Very, very, very important announcement. Nobody should be going to work if they are sick. I don't care who you are. I don't care how essential you are. You should not go to work if you're sick. If you have a cold, if you have a cough, if you have a fever, if you have aches and pains, if you have the sniffles, it is not okay to put on a mask and go to work. That's not okay. What you should do is go get yourself tested. We're at a place now that if you're feeling sick, we have plenty of testing. Go get yourself tested and do not go to work. Please. We know that it's the folks with symptoms that are the most contagious, and we're really trying to tamp down the spread of the virus at this point in time. I want to remind everybody that you're all eligible for 10 days of sick leave. That's due to the new federal stimulus program. So even if you didn't have any sick time before, we really can't have anyone going to work when you're sick. So remember, you can have sick time, at least 10 days of sick leave. And I also want to ask employers, all of you, however small and however large, do the right thing, please. And if you have a sick employee, let them stay home and pay them. And if you are operating your business, I need you, business owners, business operators, floor managers, to physically screen people and make sure no one is coming to work sick. It's the most important thing that we can do right now. As I said, if you are sick and if you have symptoms of coronavirus, we want you to get tested. We have the ability to do thousands of tests a day now in Rhode Island, thanks to a lot of hard work by a lot of people. So we want you to go ahead and get tested. And I want to take a second to review the ways you can get tested. If you are a parent and your child has corona-type symptoms, call the pediatrician. Call your pediatrician. Your pediatrician will give you advice, and if they think it's necessary, they will get you an appointment at one of our National Guard sites for your child to go ahead and get tested. Or some pediatricians have actually set up respiratory clinics in their offices, and you can go there and get the swab. If you are someone who's, basically healthy, young, don't have to go to work, but you feel sick, I want you to call your doctor, or call an urgent care center, or call the Department of Health if you don't have a doctor. Tell them your symptoms, and if they think it's necessary, then they'll send you to one of our National Guard sites to be swabbed and get tested. Those tests are very accurate, but it'll take a few days for you to get your results. If you are an essential employee, a healthcare worker, somebody who's over 60, somebody who has to go to work, then go on CVS.com and sign up to get a test at the new CVS site, because those results you receive right then and there. Between the time that you're swabbed and the time that you get the result of your test, it's less than a half an hour. A quick note on that. Yesterday, statewide, we did about 1,800 tests. I want to see that go up. I want that to ramp, because I know I've been asking you to hold off, but now to all the PCP, all the primary care providers out there, all the pediatricians, urgent care, you at home, let's go ahead and get tested so we can figure out exactly where we are with this virus, and also we can isolate you if you are positive. Yesterday was a very good day at CVS. It was kind of a soft launch. Everything went very well. They're working out the kinks. They're going to build to 1,000 over the course of this week. Again, I want to thank CVS. I want to thank the National Guard. I want to thank National Grid. They powered up that site pretty much overnight, Sunday night, and that was no small feat. So thank you, National Grid. Thank you to everybody who's there working and making this happen. A few other announcements. Earlier today, I signed an executive order directing hospitals to submit daily reports to the Department of Health around how many supplies they have and how many coronavirus patients they are treating and how many people they are testing. So first, I want to begin with a thank you. Thank you to Lifespan and Care New England, especially our biggest hospital systems. But thank you to all the hospitals. You've been unbelievably cooperative and collaborative. You've been great partners. To me and to the state and to the Department of Health, thank you. I know these are trying circumstances, and I know difficult financial times for you. You've been terrific, and I hope you know that we're in this together, and we're there to support you. You've also been great in getting us your data, and I want to thank you for that. Having said that, I felt it was important to sign this executive order just to further underscore how important this is. And also because it allows us to do a better job of procuring PPE and testing reagents and equipment and medical supplies for you and your nurses and your doctors and those who are at the hospital. Every day, all day, we're out in the market trying to purchase or get from the federal government masks, gloves, gowns, diagnostic equipment. And the very first question that everyone asks, whether it's the federal government or a commercial vendor, is what's the actual burn rate in your hospitals? How many masks are they going through every day? How many people are they tested positive? How many ICU beds are left? And so it's absolutely vital that we have that at the ready. And so we need to rely on our hospitals to continue to do what you're doing to get us accurate data every single day so we can fight for you and make sure that you and your employees are as safe as they can be. I have made a lot of executive orders and changes over the past 5 weeks. The overall approach that I've taken is to be aggressive, to be targeted, and to try to strike a balance between keeping people safe and maintaining a semblance of an economy. All difficult decisions. My top job is to keep everyone safe. Safety and health, number one. To buy us time to set up our healthcare system with testing and hospital beds and ventilators, et cetera, so that we can reopen the economy, and when we do, we can handle it. I realize it's been confusing in that I have changed the regulations and some different things expire on different dates. So bear with me for the next minute because I'm going to provide a comprehensive update on where we are and also clarity around extensions of certain restrictions. The following orders, which are currently in place, will be extended in the state of Rhode Island until May 8th. Number one, all social gatherings of more than 5 people will be prohibited. Emphasis, social gatherings. This is not places of work. This is not healthcare operations or institutions. These are social gatherings. These are churches, any parties, any kind of gatherings at parks, gatherings out and about, whether they're inside or outside, any religious gatherings, any social gatherings between now and May 8th are prohibited in sizes of 5 or greater. Restaurant dine-in. Restaurants, bars, and cafes will continue to be closed until May 8th to dine-in service. They'll be allowed to sell wine and beer with takeout orders. If you are lucky enough to be able to have the money to eat out, and order out, I'd ask you to think about tipping bigger than usual, because we got to give a hand to all these folks working at restaurants. This is an unbelievably difficult time. Business closures, public recreation and entertainment businesses, which is theaters, cinemas, bowling alleys, museums, and zoos, as well as all close contact businesses, hair salons, nail salons, barbershops, tattoo parlors, gyms, and yoga studios will remain closed until May 8th. Domestic and international travel. Anyone returning to Rhode Island from domestic or international travel by any mode of transportation must self-quarantine for 14 days. So if you're in Florida now and you're a Rhode Islander and you're anxious to come home, great, we want you to come home. Please know you are ordered the minute you step off that plane into quarantine. The same goes for anyone driving here from another state. If you have a second home in Rhode Island and you live someplace else, come, use your second home, but the minute you drive into the state of Rhode Island to stay here, to live here for non-work purposes, you are ordered to be in quarantine for 14 days until May 8th. Open Meetings Act, I'll continue to suspend the provision of the Open Meetings Act that prohibits meetings taking place by phone or video conferencing, as long as these meetings still make allowance for public access. Telehealth. Health insurers must cover telemedicine for all forms of care, primary care, specialty care, mental health care, and behavioral health care until May 8th. All forms of telehealth, that's just a simple phone call as well as a video capability, and must continue to pay for these services in the same way that you would for an in-person visit. Gun permits, in keeping with the request from the Rhode Island Police Chiefs Association, I will be extending the time period that law enforcement has to complete a background check for a gun permit from 7 days to 30 days until May 8th. The following closures I am extending indefinitely until further notice. The State House will continue to be closed to visitors indefinitely. Nursing homes, hospitals, the ACI, assisted living are not allowed to have visitors at all for any reason until further notice. State parks and beaches are remaining closed until further notice. All state-based customer services, so that's Department of Labor and Training, Health Source RI, DHS, will remain online only. I'd like to make a special thank you to my own team at DHS and DLT and HSRI. You've moved mountains to make this happen, and you've done a beautiful job, so thank you. The DMV will remain open by appointment only, and all road tests are suspended indefinitely. The casinos are closed indefinitely. I will have announcements about schools and child care centers in the coming weeks. So I hope that clarifies everything, and I hope members of the media can post all of that information. The tax filing deadline is coming up, so I just want to remind everybody that I have moved the tax filing deadline for individuals and corporations from April 15th to July 15th. So you have until July 15th to file your taxes. I followed the federal government's lead. I would say, if you're able to pay your taxes on time, please do it. Just like I'm saying, if you're able to pay your rent, please do it. If you're able to pay your taxes, please do it. It's a very difficult time to continue to balance the state's budget, and so if you're in a position to pay your taxes by the 15th, I'd ask you to do that. If obviously you can't, and many people can't, July 15th is the official deadline. I want to take a second to address unemployment insurance. It's coming up a lot. First, I want to begin by just reassuring everybody that I hear you. I hear you on this, and I'm on it. It's such a difficult time right now for Rhode Islanders. So many people are unemployed. So many of the people who are unemployed are folks who live paycheck to paycheck as it is, and now all of a sudden they've been out of work for weeks. And I really wish that didn't have to be that way. and we're doing everything we know how to do every day to get you back to work quickly. Unemployment insurance is now, as of today, 8 o'clock this morning, unemployment insurance is now available to essentially everyone in Rhode Island. So even if you are a independent contractor, you work for yourself, you own a small business, you have a hair salon, you previously couldn't collect unemployment insurance, I want you to file now for unemployment insurance because you're now eligible. It's still taking us a while to process these claims. To give you a feel for it, since March 9th, when we started this, we've received over 100,000 claims. We've never seen anything like this. 105,000 claims as of early this morning. We have processed more than 70,000 of those claims. The ones that take the most time are the ones where the application isn't complete, there's a discrepancy of information, maybe the Social Security number is incorrect, and those are the ones that require a human being at the Department of Labor and Training to go through the details, and that takes us longer. We're working on improving. Right now, as I said, it still takes between 7 and 14 days from when you file to when you'll get your check. We are working on technological solutions. We hope to have faster, better technology to process this more quickly and to streamline it. And we're also trying to figure out how to have more people to help us do the work, or maybe change the workflow so there are fewer steps in the process. So I'm asking for a little bit of patience at a time when I realize you're probably out of patience. But I want you to know it's not for lack of effort and creativity. We are looking for all ways that we can to improve the technology, improve the workflow, and work as hard as we can to make sure that you get checks in your hand as fast as you can. I would ask you please to go online. The best thing you can do to get your checks quickly is to go online versus the phone and do everything you can to make sure the application is completely correct with absolutely accurate information. If you take a little more time to have a more complete, accurate application, it will really speed up the time that we could get you the check because we're at a place where those can be automated. It's the ones that are a little more complicated or imperfect information where we have to do a manual process, and that takes us more time. I'm going to stay on this every single day until it gets a little bit better, and I'll be back to you in the days and weeks to come to give you more announcements on what we're doing to improve this so you can get your checks more quickly. I'll end with a little bit of good news on a kind of a happy note. I'd say overall, although this is a really difficult, trying time with all kinds of pain and suffering, I have been so heartened and overwhelmed and inspired by the gestures of kindness and gratitude and patience and empathy that are happening every day all over Rhode Island. It's really special to see. It's amazing. People looking in on neighbors, sending people flowers, shooting a text to make sure folks are okay. Please keep that up. It's the only thing that's going to get us through this. To that end, I want to highlight a very specific thing. I want to ask everyone to do this. Take a minute to go to nextdoor.com, www.nextdoor.com. Sign up for a free account. I want to thank the folks at nextdoor.com. They're offering this as a free service to the people of Rhode Island. Sign up for a free account. Go on the website and take a look at the help map. You can go there to see who in your neighborhood needs help, who might need a hand with errands, who might need a hand with groceries, who needs whatever. It's a really cool tool to connect us as neighbors. And so if you have a minute, take some time today, nextdoor.com, help map. Sign up yourself to help a neighbor. And if you need help, don't be afraid to ask for help. Everyone needs a hand right now, and I mean everybody. If you think you're struggling, I have news for you, we all are. If you think you need a hand, we all do. And if you don't need one today, you might in a week from now. So dig deep if you can and help out a neighbor. And if you need a hand, go on nextdoor.com and don't be afraid to reach out and ask for some help, because it's that kind of charity and kindness that's going to see us through this. So I'll turn it over to Dr. Nicole and come back for questions.
Good afternoon. Thank you for those updates, Governor. I also want to publicly thank Dr. McDonald for filling in for me. He's one member of the incredibly talented and dedicated team at the Rhode Island Department of Health working on this response. As the governor said, we have 147 new cases today. This brings our total to 1,229. As the governor also shared, we sadly have 3 additional fatalities to report. 2 of these people were in their 70s and 1 was in their 90s, important members to their family and their community. One of the people in their 70s was a resident at Oak Hill Health and Rehabilitation Center in Pawtucket. The other person in their 70s and the person in their 90s were both residents at Golden Crest Nursing Center in North Providence. We now have a total of 30 COVID-19 associated fatalities in Rhode Island, unfortunately. One of the most important messages for us to get out right now is if you work in a nursing home or if you work in another healthcare facility, you need to stay home if you are feeling even the faintest of symptoms. The governor touched on this earlier. This is so critical for our healthcare workers who are able to do this. If you have even a tiny cough, you need to stay home. If you have a headache, you need to stay home. If you have an upset stomach, you need to stay home. Because of what we are dealing with, this is absolutely not negotiable right now. We need you to be thinking about the patients and residents in your care. And the best way you can provide that care, because we know all of our healthcare workers are committed to the patients and residents in their care, one of the best ways to provide that care is to stay home if you have any symptoms of illness. Additionally, people who work in nursing homes and other healthcare facilities should be wearing cloth face covers while out in public. The same goes for the other members of our critical infrastructure workforce. Who else is a member of our critical infrastructure workforce for Rhode Island? It's a long list. These are our firefighters, our people in law enforcement, our people in critical manufacturing fields, people who work in the food and agricultural industries, and many others. We have a list online that will be posted to really be able to apply the cloth face covering. It should go over your nose and your mouth and can be something as simple as a scarf, a bandana, or a t-shirt. As a reminder, these cloth face covers are not so much about protecting the person wearing the cover, but they are more about protecting the people around you. When we cough and sneeze, and sometimes even when we talk, germs can be spread if they are present. It's important to know that we should not be sharing these face cloth coverings. They can be washed after each use or at most each day. Separately, I want to add a few things on testing. One question we got a lot yesterday was, if I get a negative test, what do I do? If you got tested, you were experiencing symptoms of illness. That's the way the test works best. So that means even if you got a test that was negative for COVID-19, you still have symptoms of illness and still need to stay home. That means regardless of the result, you should not be going to work and should keep a distance from other people, even within your own home, and certainly shouldn't be out in public. The last thing we need right now is people getting other people ill with anything, COVID-19, flu, cold, or anything. A second note on testing. There has been a lot of information shared over the last few days and weeks about testing, including who can get tested, the fact that we have expanded testing, where to go to get testing, and what the process is, who to call to get that process going. If you have a question about testing for COVID-19, it's probably going to be answered on the dedicated COVID-19 testing webpage that we have online. That page is health.ri.gov/COVID/testing. The other thing you can do is just go to our Rhode Island Department of Health homepage, health.ri.gov, and click on the COVID-19 banner that's in the middle of the homepage. And then you can click on the testing tab on the left to get this information, which is available in English and in Spanish. Included there is also information about respiratory clinics. This is an important resource that we have here in the state that we want to bring attention to, because respiratory clinics have been going on for some time. We do credit the providers and the staff who have been staffing those so that you can have this resource. Respiratory clinics are urgent care centers and primary care providers in Rhode Island that have set up separate areas specifically for evaluating patients suspected of having COVID-19. We want to make sure that everyone in the state who has concerns and feels as if they need to be evaluated has a place to call where they can go and safely be evaluated for those concerns, or be referred for a test, or actually swabbed at the respiratory clinic for testing. While these respiratory clinics are located in specific areas just for the patients who are being evaluated for COVID-19, it's important to know that urgent care centers are still open in their normal area to see patients who need other services in their usual locations. We have a list of respiratory clinics and their phone numbers online on this testing page that I told you about, health.ri.gov/COVID/testing. The key to remember is to call first. No one should be showing up to any healthcare facilities, respiratory clinics, urgent care centers, primary care docs, emergency departments. It's important to call first, and starting with your primary care provider is the best way to go, calling them. If you don't have a primary care provider, urgent care centers are available. It's also been mentioned that the Rhode Island Department of Health information line, COVID hotline, 222-8022, is available as well to help you be referred to the appropriate provider if you don't have one. These respiratory clinics are a different model. They're innovative. They're in response to this emergency. Similarly, the CVS drive-thru testing sites are also a different model. We're one of the first states to do it. It's critical to expand access for everyone, and it's part of this emergency response. These are things we are doing now to respond with this pandemic. These are immediate-term solutions that you can see are in place across Rhode Island. It also allows us to highlight what the long-term solutions are, and it's continuing to have the incredibly talented and dedicated primary care providers who are out there doing what they do best, connecting with their patients, evaluating their patients, providing them the information they need, and making sure that they receive the treatment that they need as well. That's what we're all accustomed to, and that's where we want to keep going as we build out this system and make sure that everyone has the access they need across the state. We sincerely appreciate the patience, the partnership, the determination, the flexibility of all healthcare providers and all Rhode Islanders for that matter. This is how we need to be in this pandemic to make sure that we are as pinpointed as we can be in addressing the needs of Rhode Islanders. Getting through this crisis is going to require all of us working together. So each time we're talking to you about following the social distance requirements, the stay-at-home order, that's where you do your part. And we can know that healthcare providers across the board, in hospitals, in nursing homes and assisted living facilities, in ambulatory clinics, in these respiratory clinics, staff, everyone is playing their part to help make sure that we are all safe. So let's make sure that we continue to do this together. With that, I'm going to give it back to the governor to get us started with questions.
Good afternoon.
Good afternoon.
We begin with a question by Steve Alquist of Uprise RI. Will undocumented immigrants availing themselves of public service during the pandemic be penalized under Trump's public change rule, endangering their ability to become permanent legal residents or citizens?
Yeah, thank you for the question. I want to speak directly to Rhode Island's immigrant community. We want you to be safe, and we want you to come forward, get tested, and get health care. None of the information that we take from you will ever get into the hands of an immigration authority. There are no immigration officials at any of these testing sites, even though they look official and there are people in uniforms. You do not have to pay. If you show up, you will not be asked to pay. And there are places that you can get for a test, and there are places that you can receive treatment for free, the various free clinics. So if you're in these communities, life is already difficult and there's a lot of reason to be afraid. I need you now to know we are going to do everything we can to take care of you and your families. And if you feel sick, please get tested. Go to cvs.com, call your doctor, go to cvs.com and sign up for an appointment to be tested. Call your doctor, sign up for an appointment to be tested. If you are sick, make sure we get you the right care. And don't worry about paying your bills for healthcare expenses as it relates to COVID-19. We're all in it together, and we want to make sure it's in everybody's interest in Rhode Island for everybody to be tested and put in quarantine and isolation if they are sick, and for everybody to get the health care that they need and deserve.
Next question from Michael Bilo of Motif Magazine. Racial disparities reported from some cities, for example, Chicago and Milwaukee, and states, Illinois and North Carolina, outside Rhode Island show black and brown people disproportionately 2 times likely to have COVID-19 and 3 times likely to die if infected. Is Rhode Island measuring this? If so, what are the numbers? If not, why not?
Thank you. That's an important question because addressing equity is a key part that we need to continue to follow even during a pandemic. As we are collecting data, we are looking at demographics that help us understand the equity lens. How are people of various racial and ethnic groups impacted? How are people who have housing instability impacted? How are people who have differing abilities impacted? That's data that we are continuing to analyze because so much is coming in at one time. I don't have that in front of me right now, but I appreciate that question and the focus on continuing to make sure that we are incorporating the equity lens into this tremendous amount of work that we're doing.
Next question is for the governor. Where does the surge peak play into your plans to reopen the economy? Is it out of the question that we start to reopen the economy before we hit the peak, assuming testing, PPE, and hospital capacity is where it needs to be? This is from Matt Allen.
Yeah, it's a great question. So the answer is no, it's not out of the question. The truthful answer is we're still trying to figure out, or I'm still trying to figure out, in consultation with public health experts, the CDC, other governors, trying to consume as much information as I can, trying to figure out exactly what needs to be in place before we can get to the business of reopening the economy. And the most important things are that we have an ability for rapid, widely available testing. We have an ability to quarantine and isolate as many people as necessary at any one time, even in a surge, and really effectively isolate people. That our hospital system is at capacity, including having necessary amount of ventilators and access to ventilators, and that we have necessary personal protective equipment across our system. I will be making announcements probably early next week, at least around how I'm thinking about reopening the economy. I will say this, there's not going to be a flick of the switch. In no scenario will I or any governor or anyone be able to say it's back to normal tomorrow. It's going to be a process, industry by industry, new regulations, industry by industry, somewhat gradually, so that we could keep everybody safe. And as you can imagine, it's going to be much more difficult to bring back online businesses who rely for their business upon large gatherings as compared to other businesses in a more controlled environment. So more on that later, but I thought it would be important to give you a window into how I'm thinking about it. Hope to talk more about it late this week or next week. And the only thing I'll say is I think about it probably more than anything. And look, I would love Rhode Island to be among the first to start to see some commerce going again, because I think it's necessary. There is a link between economic health and physical health. And right now, there's a lot of people whose physical health and mental health is struggling, is not where it needs to be because of their economic condition. And I'm so aware of that. But by the same token, I can't let us go back to business as usual unless I can do it in a way that I know is safe, or as safe as possible.
James Nanny with Law 360 asks, are you still calling for a new or increased taxes in light of the COVID-19 pandemic, such as adding a tax tier to the property transfer tax or adding software as a service and lobbying to the sales tax base?
Yeah. So the budget that I proposed to the legislature in January is, I don't even know how or if it will resemble the budget that we wind up passing in June. We are in a whole new world right now. Our third largest source of revenue is the casino, which has been closed for months. I just explained to you we have over 100,000 people who filed for unemployment insurance. Our economy's done nothing for over a month and will for the next month. The good news, I suppose, is that we'll be receiving over $1 billion of federal stimulus within the next month. So all I can say right now I still have to get through this immediate crisis, keeping people safe, setting up our hospital system, getting our system ready for the eventual surge. We're going to have to get to the business of balancing our budget, layering in the federal stimulus. But the fact of the matter is we do need revenue. So our revenues have fallen off a cliff, and I will take the whole thing. I'm not going to comment now on one particular piece of it. I'm going to take it all in whole and work with the legislature in partnership and with the same guidelines. Keep everybody safe and healthy, maintain the state's liquidity, look out for small businesses and individuals who are in a great deal of pain, and still continue to look to make targeted investments in our economy because we have got to get people back to work.
Next question is from Steph Machado of Channel 12. Mayor Loza has closed all Providence parks to pedestrians, not just the parking lots, and also walking paths such as Blackstone Boulevard. Is this something you'd consider doing statewide, or does it go too far?
Yeah. So first I will say I respect the mayor and I respect his judgment, and none of us is making perfect decisions right now, including me. I have not taken that approach because I think people need to be able to do something. And as I've said so many times, going for a walk is good for your physical health and your mental health. Children are cooped up all day at home, doing their schoolwork. I think it's important that they be able to go outside and run around a little bit. So I'm not going in that direction, though I can certainly understand why he chose to. What I'm doing is I'm gonna stay right where we are with our restrictions, not look at this point to increase them, but a lot of monitoring. So a week ago I was very concerned that the crowds in grocery stores and big box retailers were too large. It's gotten better since then. We're monitoring it, it's gotten better. The crowds over the weekend at our state parks and beaches were much smaller than they were a week before. So as long as I want everyone to be able to do as much as possible safely, and as long as we can enforce and have compliance with the rules that we've put out there, I'm going to try to hold the line where we are. But I absolutely respect the mayor.
Tara Granahan asks, Governor, people are wondering what the Lieutenant Governor's role is in this crisis and why he's not with you. Is he prepared to step in if need be?
The Lieutenant Governor has been a great partner to me, not just in the crisis, but since I've been governor. He's doing the smart thing, which is working from home, consistent with our directives, and I have every confidence that he'll do whatever is necessary at any time to help the cause.
Next question is from Jim Hummel. Many Rhode Island businesses have had to make the painful decision to lay off or furlough employees because they don't have the income to sustain the payrolls. The state of Rhode Island, likewise, has lost large chunks of revenue during the shutdown. When will you begin laying off or at least furloughing employees?
Yeah, so I'll make a comment and then I'll ask Brett Smiley to comment. First, I want to thank our state employees. Many of them are the essential employees that have to come in and work, so thank you for your bravery and courage and willingness to do the right thing. Secondly, we have thousands of people now working from home, which we've never done before, and I appreciate you being productive from home and helping us. Thirdly, I cannot say that furloughs and layoffs will never come, but I am going to do everything I can to avoid it, because the last thing I want to do right now is contribute to the state's unemployment rate. But Brett's doing a terrific job, and I want to give him a chance.
Thank you, Governor. And I also want to continue to thank our state workforce. One of the things that we've been able to do to continue to keep the risk of furloughs and layoffs at bay is continue to rely upon the cooperation and flexibility of our state workforce. And so I guess what I would say to add to the governor's appropriate comments are that so long as that we can all continue to work together and so long as our workforce can continue to be collaborative and cooperative, we can keep pushing that threat out. So for example, we've had other state employees volunteering some of the phone banks and hotlines at the Department of Health. Sheriffs who aren't in the courthouse right now, some of them are helping at DLT. So long as our state workforce continues to work with us, to be flexible, to be cooperative, and we're doing our part to be cooperative and flexible with them with things like telework and extra paid leave, then we can all try to get through this together, putting off some of the more painful decisions that none of us want to have to make. So we're going to continue to stay in close collaboration with the unions, with other department directors, and all the hardworking state employees so that we can try to avoid that possibility.
Next question is for Dr. Alexander Scott from Tanya Signori of the Rhode Island Echo. Good afternoon. Does sipping water every 15 to 20 minutes help prevent COVID-19 from taking over the lungs?
Thank you for that question, Tanya. There's still a lot that's being learned about COVID-19, so I have not learned any scientific information that says that water would help prevent COVID-19 from taking over the lungs. However, I do support getting sips of water on a regular basis, particularly seniors, those with differing abilities who are home. You may forget sometimes to make sure to stay hydrated and to do what you need to have the rest that you need to help protect against being impacted by COVID-19 or any other viral illnesses. So I strongly encourage doing things like taking sips of water to stay hydrated. It's something I talked to my mother about just yesterday, to make sure that we are continuing to do what we need to help minimize risk of any infections overall, whether COVID-19 or otherwise.
Doctor, you've already commented on this, but Tony Mendez of POTR 102 asks, when will Rhode Island start reporting the racial breakdown of the COVID-19 cases? He says that he understands other states are already making this information public.
Yep, it's a great question. As with the other one, it's one of our focal points, and I'm going to get back with the team to see how we are with the data that's being analyzed and collected to be able to start sharing that, because we do want to make sure that the types of demographic information that I shared earlier continue to be in our forefront as we help understand how Rhode Islanders are impacted by this pandemic and respond to that appropriately.
The next question is for the governor from John DePietro. Could you advise residents of Providence the rules for walking, running, and dog walking?
All are allowed. I would encourage them all. You ought to walk, run, fast walk, jog, dog walk, do whatever you can to maintain your physical, mental health, and I'm a big believer in getting some fresh air. The only thing is, social gatherings are limited to 5 or fewer people. So if we see you out and about, outside, in a park, in a dog park, closely gathered with a bunch of people, we're going to ask you to separate yourselves. And again, I would just remind you, we don't want you hanging around with a different 5 people every day. So if you have 4 or 5 people in your family who you're living with, go for a walk with them. That's fine. We want you to continue to do that. What we don't want you to do is go to the dog park and see all of your neighbors, and before you know it, there's 5, 6, 7, 8 of you all congregated closely. That's a problem, and if we see it, we're going to break it up.
The next question is from Alan Gabberty. Information obtained from the Rhode Island Department of Health projects COVID-19 related deaths for April over 2,300. Is the administration and the Department of Health securing PPEs for funeral homes as well as healthcare workers? And given the number of projected deaths, what is the state prepared to do to help funeral homes given increased safety and financial instability?
Unfortunately, these are important questions that we are fully prepared for and addressing on a daily basis. We are having conversations with funeral homes, funeral home directors on a regular basis, being responsive to them as they're engaging in the different activities that are happening now. We definitely want to make sure that they have the supplies that they need, and so our personal protective equipment supplies that can be made available to them has been occurring and been exchanged and offered to them. And we have actually, through one of our work streams of teams of people that are focused on surge planning, we have an entire focus on being able to respond to an increased number. So we appreciate the folks on the team who have been leading that effort, and it is a key component of our overall preparation as a state.
And our last question for this briefing, even with 2,000 tests a day, do you believe that will meet the demand? We're still hearing from many who are trying to get tested and cannot. This is from Kim Kalunian of WPRI.
Yes, these numbers that we're sharing, over 1,800 tests were performed yesterday. There is capacity to continue to expand beyond that. We are aiming for beyond that. We want to be able to test anyone with symptoms who is out there so that we can get a better understanding across the state of what's going on. The process has been unfolding over the last few days, so people have been patient and on some lines, but as we continue to expand, CVS will continue to expand, the commercial laboratories, and of course the Rhode Island Department of Health State Health Laboratory, which has been doing this since the very beginning, are all working very hard to make sure that we have the capacity to test as many people as we can. So continue to get that word out. We are expanding to do it. The National Guard has been partners with us. So many across state government to make sure that we can respond to the increased capacity needed for testing, because we know how critical that is, along with the contact tracing component to be able to get people quarantined and isolated appropriately as they need to.
Thank you, Doctor. Thank you, Governor.